Thank you very much for having me at this really important meeting. Good morning, everyone. I'm going to talk about the patient aspect of the system, and then my colleague, Pascale, will pick up where I'm coming from and talk about the provider. I think there are a number of, in terms of background, this many of you are familiar with, but I think there are a number of issues going on in healthcare right now that really point to the importance or draw particular attention to thinking about patient and the patient characteristic. One thing, and we were on a panel, in fact, IOM, or National Academy panel on healthcare comes home, because one thing that's happening is that there is a trend from inpatient to outpatient care where there is increased reliance on family members to provide needed care and support. In fact, in some respects, family caregivers are thought of as a very viable and important extension of the healthcare system. Another trend that's happening is that consumers are expected to be empowered and take a more active role in health self-management. There's an increased use of technology within the healthcare arena, and that has expanded the realm of health-related tasks that consumers are expected or can perform. And I think, and this was mentioned earlier this morning, the healthcare environment is becoming increasingly complex and difficult for many consumers, such as older adults, to navigate. And I think from our perspective, we really think that optimization of this new healthcare reality really requires a human systems integration approach. And I'm going to just put up one model of a kind of a human systems model of healthcare. And this is actually the model we developed for our report, Healthcare Comes Home. And there's just a couple of, you're not going to be able to go through all the model, especially in the time we have, but there are really four main components: the person, which includes the patient and the providers, the tasks that they're engaged in, any equipment or technology they're using, and then, of course, the environment, which itself has many layers: healthcare policy, social environment, physical environment, et cetera. The important point of this model is, in fact, that these components are interdependent. Okay, they, in order for the system to work optimally, they have to work conjointly, and they have to, the system demands have to match with the capabilities of the person in the system. So if we think about, I'm just going to go through a couple of the components. One in particular is, one component of the model is, of course, the people. And in this model, all right, we have to think about, if we want to think about two categories really of people, it's the people receiving care, who vary along a number of very important characteristics, and I'm going to pull apart some of these in a minute, as well as the healthcare provider. And we've heard a lot about the provider already this morning. Recognizing that in today's healthcare world, the provider has a couple of subcategories. There are our formal healthcare providers, our clinicians, et cetera. And then there's our informal providers who are our family caregivers. I think right now there's about 29 million family caregivers in the United States who are providing care to someone who has an illness or a disability. And these family caregivers, and as well as formal care providers, also vary across a number of characteristics. So if we look at just the patient part of the picture, which I'm focusing on, I think it's very safe to say that if we look at our current patient population and we think about our future patient population, they're going to be characterized by increased diversity. And one important thing to consider, which is what we really do in our CREATE Center, is think about age. Our population in the United States and other parts of the world is getting older, and we know that in general, older adults use more healthcare services than do younger people. And something I think that's really critical here is the increased number of people who represent the oldest old. Okay, this is people 85 and older, and in the upcoming decades, we're going to see a lot more people living into their 90s and even 100 and beyond. okay? While that's terrific, a lot of these folks have multiple comorbidities and need health care. There's also increased diversity in terms of ethnicity and culture, which has tremendous implications for design of healthcare systems. Not only in terms of language, that's an obvious factor, but we have to think about cultural differences in healthcare beliefs, in understanding of the healthcare system, in understanding of how to negotiate the healthcare system. I live in Miami. It's a very diverse population, and many of our patient populations have really a hard time trying to negotiate for the care and services that they need. Obviously, the patient population is diverse with respect to education and income. And also, I want to point to the fact of literacy, okay, because literacy has a pronounced impact on people's healthcare behaviors and successful negotiation of healthcare systems. And these numbers are kind of, every time I look at them, I'm kind of shocked to realize that right now, about 30% of our adult population has below or basic healthcare literacy, and 38% only has intermediate healthcare literacy. Okay? That has vast implications for patients' ability to navigate the healthcare environment. And coupled with that is many patients do have some sort of cognitive impairment, especially older adults, and this is going to increase as we see more and more people in the older cohorts. Okay? So we also want to think about the tasks that people are performing. There are a variety of tasks that people engage in when they're involved in healthcare. With respect to scheduling, there are a number of issues that patients have to confront. With whom and how do I choose my provider or my tests? There may be multiple providers I need to see. Where are they located? When and how frequently do I have to schedule an appointment with? How do I coordinate multiple appointments? And how do I do it? Do I call up an office or now do I use a patient portal? And understand that people are trying to perform these tasks in the context of having to perform a lot of other tasks. Think about the adult daughter who's caring for their parents. They also have to schedule events for themselves and their own family as well. And then, of course, there's the equipment or the technology being used, and there are a number of dimensions that we need to focus on with respect to that. In particular, if we think about an emerging technology, and I'm not picking on any one portal, there are patient portals that are coming online now and are increasingly being used that allow patients to schedule their appointments online, okay? And this is part of that whole trend of patients being more actively involved in their own health care. And I think these systems are terrific and have a lot of potential, but we've been doing some research on them lately from a usability, consumer, patient perspective. These are some of the articles if you want to look them up. And generally, we have found that patients have a pretty positive attitude towards these systems. They're willing to use them. They think they're valuable. They actually think they'll improve their ability to manage health conditions. And apropos to this meeting, one thing that we consistently find is people are excited about being able to schedule their appointments online instead of having to be put on hold when they call up a doctor or a clinic. Okay? However, we also find that many adults, and this is not just older adults, are unable to access these systems. Okay, they don't know how to use them, and they have difficulty, and we have data to support this, performing basic health tasks like scheduling appointments or interpreting lab test results. So while these systems are available, I think they're not there yet in terms of being designed for who our patients are. Okay, and we've also done some regression modeling to figure out what individual characteristics are important to performance, and these are the ones that consistently pop up. The person's age, their abilities, and as I said earlier, their health literacy, and particularly their health numeracy. So in conclusion, I think there are enormous opportunities as well as challenges for our discipline, human factors engineering, in the design as well as the implementation of scheduling systems. And we really think that unless we use this integrated human system integration approach, that healthcare disparities are going to increase, and there's going to be a wider gap between the have and the have-nots. And I think fundamental to the elements of this approach are knowing the user and understanding that the user is not just the provider, but the user is also the patient and most likely a family member. And we like to involve users early and continually through the design process. Thank you.